Nigeria, a country of 160 million people and counting. A country with a drug use problem that is further worsening by its criminal justice approach to drug use. According to the National Drug Law Enforcement Agency Act, anybody who knowingly possesses or uses the drugs popularly known as cocaine, LSD, heroin, or any other similar drugs by smoking, inhaling, or injecting the said drugs shall be guilty of an offense on conviction to imprisonment or a term not less than 15 years but not exceeding 25 years. This law has been a tool used by law enforcement agents in the fight against drug use, and this has sadly driven some drug users underground, and its public health consequences could be a time bomb. According to a report by Youth Rise Nigeria titled, "We Are People," law enforcement agents perpetrate human rights abuses in a bid to keep our society free from drugs, and this abuse happens to people like Abigail. Abigail is a 25-year-old resident in the FCT, recounted how she was raped by some policemen on the account that she admitted to the use of illicit drugs. In order for her not to get arrested, she was made to pay with her body. In her words, "They forcefully climbed me to make love with me, so I was begging that it will just be one person, but they refused and took turns to have sex with me. My body was violated." Abigail's case is just one out of the many cases of human rights abuses that young people who use drugs do experience on the hand of law enforcement officers. Mr. X uses drugs, and he is not a problematic user, and he has this to say.
There are many young people who use drugs in my locality and in my constituency have been victimized, especially female ones have been raped, and from a presentation done today, at least I was witness to some of the presentations that were done and presented during this activity for today. I've also testified that some young people have been raped, have been beaten, have been extorted. Just because they use drugs, they have been slept with by law enforcement agents, and because they are young people and they cannot speak out, I would say that the drug policies affecting young people is not friendly at all. And they don't even have access to rehabilitation, and rehabilitation that is right-based, not just anyhow rehabilitation, but right-based rehabilitation. Young people who use drugs like me and others do not have access to that.
Mr. Y uses drugs, and he's also a peer educator, and shows us the kind of harmful drug practices that young people and children engage in underground outside the eagle eye of law enforcement agents.
You can see the entrance. Nobody will know there is a passage through here. You understand? Yeah. So the fact is, I just want to show you the main practices they practice around here. Most of the drug users, what they do is, after they don't have easy access to syringes from the pharmacy, you understand? So whenever they get one and they use, they tend to reserve that one for tomorrow usage. And I think they continue using that same syringe until maybe they feel like they can afford another one. You understand? They have a method of hiding syringe. Let me see. They hide their syringes behind the banana tree. Okay, he's not here. Okay, please take it over. There's one there. Yeah. That is the method they do in keeping their syringes. You understand? So, this particular method, you can see, this is where they keep their syringe. They put it inside here, and they actually feel it can be sterilized itself, you know, African mentality and all that. So tomorrow they still come back and use it. There's a possibility of sharing this syringe within these users, because as you can see, there are a lot of IGUs there. You understand? I can imagine the number of syringes that was around. You know it won't go around. So definitely the thing they do is they share the syringes. You understand? But this is their own optional mentality of preservation. You can see it. You keep it here. You understand? That is how you keep it. You understand? So they tend to hide it at the back of this.
With the health implication associated with harmful drug practices in Nigeria, CP Emmanuel C.S. Ojukwu, who is the first public relations officer of the Nigeria Police Force, has this to say.
On our part, our job is to enforce whatever law that the people of Nigeria put in place. We don't really have opinion as to law. But if you ask my personal opinion as a psychologist and somebody who has been in the system for 30 years, I do know that some drug users are actually victims of the issue at stake. They are victims. And you don't further victimize the victim. Personal opinion, as somebody who is interested in life and human development, my opinion as a father, as a psychologist, as a pastor, as a counselor, most drug users are victims. They need help.
The National Drug Law Enforcement Agency operates a drug treatment regime shrouded in secrecy, as all efforts made to speak to the agency about Nigeria policy proved abortive. Nigeria drug policy is of great concern to public health experts like Ochonye Bartholomew Boniface, who is the chief of party of Heartland Alliance Nigeria and has years of experience working with key affected population. Ochonye Bartholomew Boniface is the chief of party of Heartland Alliance Nigeria with experience working with key affected population.
If you want them to stop, it's not by criminalizing them, it's by coming up with other innovative ideas, to support them so that they can gradually, just the way they gradually started taking drugs and become addicted, they can also gradually come out of it if we have a robust, comprehensive package of interventions, that we put together for them.
Even if we use drugs, you understand, we still need some form of help to come out of such situations. So we don't expect the society to neglect us. You understand? The society don't have to neglect us. The society should be there to help us. They should support us, don't punish us. You understand? And for us to be supported, we should be part of the process of support. We should not decide our fate at the back, then come in to push things to our feet. But we want to be part of the process of that support. So any policy that is going to be affecting young people who use drugs like I and others should bring us to the table to be part of that process, because it's challenging growing up as a young person who use drugs.